Hi, I'm Obona Uchenani, founder and CEO of Mikado Corner Limited, the company building MediTrust360. And I have two members of my team here, Mohammed Banama Mohammed, the Chief Technology Officer, and Oluwafemi Emmanuel Oju, the Product and Project Manager. They will be talking to us on why the product at this time and why we are the best team to build this product. Over to you, Oluwafemi.
Yeah, good morning, Obuna. It's nice to be here and looking at what we are doing purposely because we need to talk about the product, MediTrust360, as the product and project manager. This was born out of experience over the last 15 years. I have worked across public health. I have done a lot of work in net information management, digital health, humanitarian and emergency response, as well as developmental. I have seen at first hand most times the challenges that are being faced, especially in how to reach locations, what the lack of data can do in terms of damages to rescue and reduce mortality and mortality. A lot of data across the country as a whole, they are fragmented, they are disconnected, and they are majorly not available. So when you look at this, it becomes one of the major reasons that during outbreaks, the mortality increases. So this call for a thinking in the era where artificial intelligence, information management, data availability can rescue and save life. So this brings about us as a team thinking about how do we bridge this gap in reducing mortality. Then MediTrust came on board by helping us to build the trust between the end users and we, the owners, as well as the facilities across the nation, connect them to their foundation in terms of information management to make sure right decisions are being intelligently made to support these patient treatment outcomes and reduce mortality. Thank you.
Thank you, Olafemi. Good day to you all. My name is Mohammed Banam Mohammed, the Chief Technology Officer. We believe we are the right team because this challenge requires more than software development. Abona brings leadership, strategy, partnership, and a decade of experience in humanitarian and developmental context, while Olafemi brings deep public health information system, and product management experience. I also bring a software engineering background with decade of experience in building real-world solution with more than 5 million users reach across sectors in public health programs like SMEP, the seasonal malaria chemotherapy and ITN campaign. And I have also worked with other sectors, both in humanitarian and developmental context. With this experience, I believe this challenge requires not only a software background, but also deep understanding of field level activities, how these data, how interconnected data and interoperability of health information system and health product can lead to greater impact. Thank you, Anova.
For me, MediTrust360 is more than a business idea. It is also personal. My father suffered partial stroke and spent more than 3 months in the hospital receiving treatment. Sadly, we lost him. But that experience gave me an understanding of how vulnerable patient and family can feel when someone they love depend completely on healthcare system. Later, in my work in humanitarian and development sector, I encounter much deeper challenge. Essential service delivery struggles because information, systems, and institutions are disconnected. When I look closely at healthcare system, I saw the same fragmentations. Patient health record remain trapped in paper files and disconnected systems. If a patient switch facility, their complete health history may not move with them. This discovery led me to a simple question. What if a patient health history could follow that patient all through his entire healthcare journey? That question become MediTrust360. Our vision is to build trusted, interoperable digital health infrastructure, connecting patients, healthcare providers, insurance around continuity of care. We envision a future where AI can responsibly help transform connected health information into useful insight for clinicians, patient and health system, with privacy, safety, and human clinical judgment at the center. We are starting in Nigeria, but our long-term vision is to help build more connected healthcare system across Africa. Thank you.